Members, this is the appointed time and we've formed a quorum for the Health Services Panel meeting. The first thing on the agenda is election of chairman and deputy chairman of the panel for the 2019-20 session. Members, please be reminded that according to Rule 77(6) of the ROP, a member who is the chairman or deputy chairman of a government advisory body in respect of matters which a panel considers to be directly related to the terms of reference of the panel shall not be the chairman or deputy chairman of the panel. And Rule 77(7) of the ROP also provides that a member shall not be chairman or deputy chairman of more than one panel at the same time. According to the election procedure set out in Rule 22 and Appendix IV of the House Rules, I now invite nominations for the office of the chairman. A valid nomination shall be made orally by a member, seconded by at least one other member who should not be the member being nominated, and accepted by the member being nominated. I now invite nominations from members. Mr. Ray Chen, I'd like to nominate you, Dr. Pierre Chen. Dr. K.K. Kwok. Second, I accept the nomination. Dr. Joseph Lee, can you please take over?
好，咁啊繼續提名，咁咧就冇提名咧，係張慶信議員。
我提名阿蔣麗芸議員，唔該。蔣麗芸議員。
蔣麗芸議員係有冇人和議咧？何俊賢議員和議，蔣麗芸議員你已經應承啊？
我接受好嘛？
好，接受咁。係。好唔好我唔知喎，你係。
我冇應承。
你問我好唔好，但係我唔知，即係我喺度替工嘅啫，你接受。
I don't know. I'm just here on behalf of the chairman. All right. Do you accept the nomination? All right. Any other nominations? Any other nominations? All right, I'll count to 5. All right. I nominate Ms. Chen Hoi-yen. Any seconder, please? I think she once organized things like health ambassadors. Do you accept the nomination, Ms. Chen Hoi-yen? I don't. All right. Any other nominations? Dr. K.K. Kwok, I nominate Mr. Shiu Ka-jun. Any seconder, please? Mr. Ray Chen, second. Do you accept that, Mr. Shiu? I don't. All right. Got it. Any other nominations? Mr. Ray Chen, I'd like to nominate Mr. Tommy Zheng. Mr. Tommy Zheng. Any seconder? Dr. K.K. Kwok. Well, I have something else in mind. All right, that means you don't accept the nomination. Dr. K.K. Kwok. I think Mr. Shiu Ka-fai is very interested in matters like tobacco, things related to health. So I nominate Mr. Shiu Ka-fai. Any seconder, please? I'll count to 3. Mr. Ray Chen seconds. Mr. Shiu Ka-fai, do you accept? Well, I said the same in another room. For matters I do care for, I won't be the chairman of the relevant panel, because when I'm in the chairman post, I cannot comment on the matter. All right, I nominate Mr. Joseph Lee. Well, I don't accept the nomination. Yes, I've done it many times already. Mr. Ray Chen, I'd like to nominate Dr. Helena Wong. Any seconder? Dr. K.K. Kwok, do you accept? Dr. Wong, I do. All right. All right. We have 3 valid nominations. Any more? Dr. K. Kwok, I nominate Mr. Mr. Roy Kwong. Any seconder? All right. Mr. Ray Chen, do you accept the nomination? I won't accept it this time. Oh, sorry. Dr. K.K. Kwok, I'd like to show Mr. Shokajan some more sincerity. As we all know, Mr. Shiu represents the welfare sector. And I think he has done a very good job in welfare and health matters. Of course, Dr. Pierre Chen was a very good chairman. So I urge Mr. Shiu to reconsider my nomination. I want to remind you that this is the Health Services Panel, not the Welfare Services Panel. Of course, I do know that. Any seconder? Mr. Shiu, do you accept? Yes, welfare and healthcare are more and more related. And I think I need a little bit more time to consider this nomination. So you don't agree? All right. Dr. Anna Wong. Well, I nominated Ms. Chen Hui-Yan, and she didn't accept my nomination. I think Ms. Alice Mack is also a suitable candidate so that I can compete with her. So I nominate Ms. Alice Mack. Any seconder, please? Mr. Ray Chen again. Ms. Alice Mack, do you accept? I don't. Got it? All right. Dr. K.K. Kwok. Mr. Wong Ting Kwong is wide awake now, I'm sure. So I should nominate him to show my respect. I think he must be very interested in this post. Any seconder? Any seconder for the nomination in relation to Mr. Wong Ting Kwong? All right, Mr. Roy Kwong seconds. Mr. Wong Ting Kwong, thank you, Dr. Kwok. So you can see that I am in good spirits, and I don't accept your nomination. All right, 3 nominations so far. Any more? Mr. Ray Chen? Well, there are 2 female candidates already, and it's quite likely that a lady will get the post. So I'd like to nominate Miss Eunice Yong. Do you accept? I don't. Any more nominations? Dr. K.K. Kwok? Whenever we discuss healthcare, Mr. Chen Kim-po always showed that he was very interested. I think he would be more keen on the post than Dr. N. Chen. So I nominate Mr. Chen Kim-po. All right, the nomination was made by Ms. Dr. K.K. Kwong. Any seconder? Mr. Roy Kwong. Do you accept the nomination, Mr. Chen? No, I won't. And please do something nonsensical in a very serious manner, because the community is waiting for us to consider many health-related matters. Mr. Ray Chen, I have no strong views if a pro-establishment member is to be the chairman of the HS panel. But I don't really want Dr. N. Chen to be the chairman. I'll be more short if Ms. Starry Lee can be the chairman. So I nominate Ms. Starry Lee. So are you making a nomination? Yes. Any seconder? Dr. K.K. Kwok. Ms. Starry Lee. I don't accept that. And we should trust that all members have the ability to chair meetings. After all, we are meeting together to discuss matters. Dr. K.K. Kwok, I agree that there are members more respectable and knowledgeable than Dr. N. Jang. So I'd like to nominate Mr. Abraham Sheck, but he is not present. Have you got his oral acceptance? I can ask him. Do allow me some time. All right, you can ask him because he is not present. But he is well respected. I'm sure he is more suitable than he is going to be much better than Mr. Lee. All right, you can ask him. Any more? Mr. Ray Chen. I will have another go. I'd like to nominate Dr. Elizabeth Quat. All right, any seconder? Mr. Shiu Ka-chun. Dr. Quat. I don't accept the nomination. All right, we have only got 3 valid nominations. Mr. Shiu Ka-chun, I want to nominate Dr. Fernando Zhang. He is sick today, and I think he has very good knowledge about healthcare. I have checked with him, and he has accepted my nomination. Any seconder? Mr. Ray Chen seconds. And the nomination is also accepted by Dr. Fernando Zhang. So we have 4 nominations. So we have 4 valid nominations so far. Any more? Speakers of mic. All right, I will ask once again, any more nominations for the post of the chairman, Dr. K.K. Kwok? Although Mr. Poon Siu Ping might not have spoken a lot, but he is very diligent. And in each meeting of the HSP, he was very sincere and earnest. So I'd like to nominate Mr. Poon Siu Ping. Any seconder? Dr. Junius Ho seconds. Sorry, are you going to second that nomination? Yes, I agree. I support the nomination. Mr. Poon Siu Ping is of a very high standard, and I think he is more suitable for the post than Dr. K.K. Kwok. So I support that nomination. Do you accept, Mr. Poon Siu Ping? Thank you very much, but I won't accept the nomination. Any more nominations? Mr. Ray Chen. All right. One last effort. I hope Mrs. Regina Ip can consider becoming the chairman of the HS panel. All right, Mrs. Regina Ip is present. Any seconder? Dr. Helena Wong seconds. None. I was just reminded by the Secretariat that Dr. Hannah Wong cannot second the nomination because of conflict of interest. Mrs. Regina Ip, I thank you for your support, but I am minded to take up another post. Dr. K.K. Kwok. In healthcare services is rather insufficient in the NT. So I think I'd like to nominate Mr. Kenneth Lau. I think he should be more capable than Dr. N. Jen, who is the only candidate from the pro-establishment camp here. But Mr. Kenneth Lau is not here. Can you check with him, at least orally, whether he is interested? Well, I can't see him now. I will for sure check with him first. All right, this is not a valid nomination. There is no need to have a seconder.
I don't know if Dr. Kwok have asked him any other nominations. Dr. Ki Kwok. We just now nominated Mr. Shiu quite many times, and I want him to reconsider. since they represent the social welfare constituency, I said that health care and welfare are closely connected and they need to be considered together. So I sincerely urge Mr. Xu to reconsider. I nominate Mr. Xu Ka-chun. Any other nomination? And then member second that nomination. So second by Mr. Ray Chan. So third time, Mr. Xu. I felt the sincerity, but I also learned that I have something else in mind that I learned from a fellow member. So I have to show that I do have something else in mind, because I'm not able to accept this nomination. Any other nominations? So far, we have 4 now valid nominations for the chairman. Any other nominations? So I will count to 5. 5, 2, 3, 4, 5. So now we have 4 valid nominations: Dr. Pierre Chen, Dr. N. Chang, Dr. Hannah Wang, and Dr. Fernanda Chang. And now we shall begin the nominations, the election. Mr. Ray Chen, when we asked the candidates, would they say a few words in helping me to make the choice, to make a decision? Of course, members will have the right to ask the candidates. There's no precedent before. If we can agree, then we shall have this session as well. You won't allow them to ask a few things. Well, I can't decide because I want to consult the colleagues on these arrangements. For if each candidate will be asked by other members, we just arrange another time. I didn't say that whether I would ask questions myself. So I just want each candidate to speak for a few minutes. Of course, we can suggest a Q&A session. Now, a member proposed that maybe a candidate would need to state their platform per se. Well, presiding officer, we have no candidate forum for the for panel chairman selection. I'm aware of some member making such requests. Even if you accede to this, I hope maybe you can complete it within 10 minutes, and hopefully we can elect a chairman for this panel. So it was suggested by a member I have no right to decide for the panel. So some members have proposed to devote some time to let each candidate to state their positions. That's as requested by Ray Chan. How about this? Let's say each candidate given more than 3 minutes. If there are no strong objections, we should just go ahead. Pardon me. So I want to talk about the procedures first. Some member have made such a request. So I would like to know that those present will see the need. That's not decided by myself. Why don't we put this to a vote? So on Mr. Lee Chan's proposal, may I ask the candidates, do they feel there is such need? If they see a merit or a need, then we put this to a vote. If we see a necessary, then we won't put this to a vote. May I ask the 4 candidates, do you want to have this candidate forum segment? Dr. Pierre Chan? I'm fine with it. I find it acceptable. Dr. N. Chang? I suppose we can have it been under 1 minute. Dr. Helen Wang? Now that is a contested race, in order to help members make an informed decision, I suppose allowing each candidate to state their platform on how they would lead this panel, I would see this as a good thing. I'm glad to take part. So Dr. Cheng can answer. He's in the hospital, so all 3 have agreed to them. If there are no objections, we shall let the 3 candidates to have their 1 minute to state their platform. Anyone fine with it? So I will accept it. Just now, the three candidates that we spent a little time to state their position, I suppose we can give them 1 minute each. So it was agreed by these three candidates, and Dr. Chang is not in the hospital, so he couldn't take part. So for the members agreed to let the three candidates, since they have agreed to this 1 minute speech. You object? Any other views? Do we need to put this to vote? I suppose there one objection while the others did not. I suppose we shall go ahead. I have comments on this 1 minute limit, because just now a candidate claimed that proposed 1 minute while the other two are doesn't matter, so it could be more than a minute. So why we need to set it at 1 minute? Because I heard from one candidate saying 1 minute, because the other two have no comment. Mr. Ho I'm also objected, but we wasted a lot of time. We've been many years in LegCo. We know how they behave, their personality, and so on. We stop wasting Hong Kong's public time and time of this legislature. If I'm not mistaken, there are only two panel members object to candidates stating their position in a minute. I suppose we can proceed with it. Otherwise, we put this to vote. As for the time limit, some candidate proposed 1 minute. That's why I adopt this 1 minute. If you see 1 minute is not enough, for the three candidates present, do you see this reasonable and would they accept it? So, two issues. I see there are two panel members don't see the need for the candidates forum. While the rest didn't speak, I will assume that the rest of the panel will agree to this. So that's been concluded. For all three candidates, do you see the 1 minute time limit as appropriate? Because the other two candidates did say it didn't matter. For Dr. B. Chan to see 1 minute as appropriate. I'm not sure if I can finish within 1 minute. So I want to have 3 minutes. That would be better. If you agree to 1 minute, I'll try to state my platform within 1 minute. So 1 minute or 3 minutes doesn't matter. Dr. N. Chang, 1 minute is enough. Dr. Wong, doesn't matter to me. I'm okay with even 120 minutes. So let me sum up. 2 members said doesn't matter. 1 minute. 1 member said 1 minute. So 1 minute it shall be. So I suppose we need to draw balances. Only 3 candidates. So let's start with Dr. P.H. Chan, followed by Dr. N. Chang and Dr. Helen Wong for 1 minute each on any representations for this post. Dr. P.H. Chan. Good afternoon. I'm Dr. P.H. Chan. So I served as the chairman for this panel last year, and during my tenure, I noticed that the list of outstanding items, there are quite a long list, and last year I spent some effort and also to discuss with the government to to amalgamate the list. For example, the HA issues, the obstetric, so we can combine items. So as you can see, the list had grown shorter. Of course, there are new items. And I remember back in July, before the summer resets, there was a panel meeting. Okay, time's up. Dr. N. Chang. The panel of health service, the main function is to monitor issues of healthcare issues of public concern and for Dr. P.H. Chan or Dr. Professor Lee, that been quite dedicated to the chairman's role. I found recently there were a lot of internal problems within HA. For instance, the new drugs and healthcare personnel and the shortage of registered nurse and doctors. Felt there was someone who can put in greater effort to understand the HA's problem and to support the reforms. I want to be given this opportunity to try it out. I shall do my best. Dr. Helena Wong. I cared about healthcare. So I want to respect the members' wishes when we come to the agenda items. I also follow up on primary health care and as well as the planning for allied health professionals. So we have 2 10-year hospital development plan, but however the manpower may not able to catch up, which I would like to discuss, and also want to examine the reform, corporate governance reform at HA, and also concerned about the fake vaccines and also the regulation of pharmaceutical products and its testing. And also cared about the use of medical devices and the user control, and on the quality assurance on Chinese medicine and the regulation of health supplements, which are currently lacking. Okay, with the enter procedure, I suppose there are about 2 minutes left. If the members don't mind, we need to extend by 15 minutes to complete the election. Are we all fine with it? Shall we put this to a vote? Let's enter the election procedure. Please stay at your seats, otherwise we can't count the ballot vote paper.
Okay, 請同事坐定啦。如果唔係咧，一間張票咧係要。
Okay, please stay seated. We need to distribute the ballot papers. We have 4 candidates. Please stay put if you would like to vote. So after voting, we shall collect your ballot papers. Any member doesn't have a ballot paper? Okay, please cast your vote. As soon as you cast your vote, then and after checking the candidate number, then we shall collect the ballot papers. If you have fill in the ballot paper, and the staff will now collect the ballot papers. Okay, we have hand out a total of 35 ballot papers. Correction, 30 ballot papers.
年紀大冇辦法。
Yes, I'm getting old.
好啦，請咧同
Members, please cast your votes in or put your ballot paper into the box. And we need someone to monitor the counting of votes. I know that members may have another meeting next door. It's now 5 p.m. Make sure you put your ballot paper into the ballot box.
好啦，我想問同事將你個票擺咗票。
Members, have you all put your ballot papers into the ballot box? All right. Can our staff please count the ballot papers? We need members to monitor the counting of votes. We have 4 candidates. nominated by different members. Mr. Ray Chen, you nominated Dr. Pierre Chen. Would you like to monitor the counting of votes? Mr. Vincent Cheng can monitor the counting, and Dr. Helena Wong, also nominated by Mr. Ray Chen, and Dr. Fernando Zhang, also Mr. Ray Chen. All right. We'll first count the number of ballot papers collected. Please count the number of ballot papers you've collected.
你睇下真係 OK。
好，得嚟啊。有。
2號蔣麗芸議員，
Number 2, Dr. Zhang Laiwen. Number 2, Zhang Laiwen. Number 2, Madam Zhang Laiwen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen.
2號蔣麗芸，
Number 2, Zhang Laiwen. Number 1, Dr. Pierre Chen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. This is a blank ballot paper. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen.
2號蔣麗芸議員，
Number 2, Zhang Laiwen.
2號蔣麗芸議員，
Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 3, Wong Pik Wen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 1, Dr. Pierre Chen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen. Number 1, Dr. Pierre Chen. Number 1, Pierre Chen. Number 1, Pierre Chen. Number 1, Pierre Chen. Number 2, Zhang Laiwen. Number 2, Zhang Laiwen.
冇事。我而家咧秘書處嘅朋友咧就係數緊啲。
The Secretariat staff are counting the ballot papers.
Hop, 22票同
22 votes that tallies with what is shown on the screen. All right. Dr. Zhang Laiwen is elected chairman of the HS panel. Dr. Zhang, please take over.
Thank
you very much for your support. Since there is an election going on next door, the meeting will end here. The meeting is adjourned. Thank you.